I'm Dr. Christopher Nielsen, one of the spine surgeons at Toronto Western Hospital. Let me introduce you to a new patient experience and education initiative. Please take the next 5 minutes to listen to this video on adult spinal deformity. Let's start with a story, Despina's story, back pain due to spinal deformity. When Despina was a teenager, she found out she had scoliosis. At the time, there was a discussion about surgery, but nothing was ever done. Despina had on and off back pain most of her life, but now, 40 years later, her back pain is constant and is really affecting her quality of life. At first, Despina limited trips out of the house to the grocery store or to visit friends. More recently, she avoids leaving home altogether, asking family to bring her groceries. Even standing in the kitchen to prepare a meal is becoming impossible because of the pain. Despina's family doctor has been prescribing pain medication for the last decade, but more recently, even the stronger medication does not work. I was always able to manage my back pain for most of my adult life, but recently it is becoming unbearable. I can't do anything without being in severe pain. I used to have occasional bad days, but now I can't remember the last time I had a good day. I don't want people to see me in such pain, so I avoid my friends and family. I just wish there was a way I could improve my pain. If your symptoms are similar to Despina's, then you are suffering from adult spinal deformity. What is adult spinal deformity? Well, it's an abnormal curvature of the spine. A normal spine is straight when looking at someone straight on and has normal curves called lordosis and kyphosis from the side. But abnormally shaped spines can have curves that are scoliotic or kyphotic in nature. And that makes it difficult for people to stand straight. Oftentimes, people will lean to a side or not be able to stand up straight and feel as though they're stooped over. So what are the symptoms that you feel? Well, most common is back pain, and back pain that can be quite debilitating and generally is mechanical in nature, meaning it's worse when you're standing up and doing activity. You can also experience leg pain, leg numbness, or even leg weakness as a result of the deterioration and degeneration in your low back. And you can have one or more of these symptoms together. Typically, things like standing and walking make symptoms worse, where lying down or sitting makes symptoms better. So what are your options? Well, one is do nothing. But oftentimes when patients have gotten to the point to seeing a surgeon, that's not an option that we spend a lot of time talking about. Normally we'll start with things that are not surgery. And if that doesn't work, lastly, we'll talk potentially about a surgical intervention. Things that are not surgery are typically aimed at exercise and activity, strengthening muscles in the belly and back, spinal injections to try to address some of the pain generators, whether it's the small joints or a nerve in the back, or medications that are not narcotic to help deal with the pain. But if surgery is the best option, we will often discuss a large surgery called a deformity correction, where we address the curves both in the frontal and side plane to help with standing upright. So what's next? Well, we're going to talk about your symptoms. We will look at your imaging and we'll consider the impact on your quality of life. And together, we will come up with a plan. That plan may be do nothing if your symptoms are not too bad. It could be do things that are not surgery to try to improve your pain, or in some cases, it may be discuss doing a surgery to correct your deformity. Please see these resources that you can access after your clinic visit to learn more about adult spinal deformity.